Hello, everyone, and thank you for joining the Duke Initiative for Science and Society for our latest coronavirus conversation. This conversation is being co-sponsored by the Duke Global Health Institute, the Duke Center for Innovation Policy, and the Harvard Petrie Flom Center for Health Law Policy. Hopefully I got that last one right. My name is Brian Langloss, and I'm a policy analyst at Science and Society. I'll be moderating today's conversation, which will look at the risks of COVID-19 in the workplace and the safety measures needed to protect employees. With case numbers rising in a number of states, it's clear that sound policies are needed to protect employees as they return to work. In addition to holding this event, our staff here at Science and Society have collected best practices in a policy brief that will be published tomorrow. You'll be able to access that brief on our coronavirus conversation website. Before I introduce today's experts, a few housekeeping notes. If you have any question for our panelists, please send them to Ben Shepard using the chat function at the bottom of the screen. He'll direct those questions to me, and I'll try to get to as many of them as possible. And please make sure to keep your video off and your microphone muted throughout the event. For the event, I invite you to visit the Science and Society website, scienceandsociety.duke.edu, to learn about our recent and planned coronavirus conversations and learn more about our work. You can also learn about our master's program, where our students and faculty address the types of issues we have been discussing in these conversations on a daily basis. So with that, allow me to introduce our panelists. I'll first start with Dr. Nicole Bouvier, who is an infectious disease specialist at the Mount Sinai Hospital in New York, where she also received her medical degree. In addition to her clinical duties, professor in both medicine and microbiology, and her research focuses on the host, viral, and environmental factors that affect respiratory transmission of influenza viruses. Some of our recent publications have focused on understanding patterns can affect the particles we exhale, as well as the use of convalescent plasma to treat COVID-19. Dr. Bouvier has received a number of awards, including a distinction in research for her work during her MD and the Sir William Osler Young Investigator Award. Next, we'll have Jessica E. Martinez, who's the co-executive director of the National Council for Occupational Safety and Health, which recently released the report, A Safe and Just Return to Work. She holds a Master's of Public Health from the University of Illinois in Chicago and has spent over 14 years focusing on social justice work with an emphasis on public health and workers' rights in the US, Venezuela, and Brazil. In this time, she has held a number of positions, including program coordinator for both the UCLA Labor Occupational Safety and Health Program and the Southern California Coalition for Occupational Safety and Health, and has worked as a labor organizer for campaigns in California and Illinois. In 2014, she was appointed by then Secretary of Labor Thomas Perez to represent safety professionals on the National Advisory Committee on Occupational Safety and Health. Ms. Martinez has also received a number of awards recognizing her exceptional work, including the Peace and Social Justice Award from the Southern California Institute for Popular Education and the Lauren Kerr Activist Award from the American Public Health Association. And last but not least, we have Sharon Block, who's the executive director of the Labor and Work-Life Program at Harvard Law School, which focuses on critical labor issues and their societal implications, and just released the report, Worker Power and Voice in the Pandemic Response. Ms. Block has served as the head of the policy office at the Department of Labor under President Obama, senior counselor to Secretary of Labor Tez, senior labor and employment counsel to the Senate Health, Education, Labor, and Pensions Committee, and a senior public engagement advisor in the Obama White House. She also serves on a number of boards and advisory committees, including the National Employment Labor Project, the Massachusetts Attorney General's Labor Advisory Committee, and the Equitable Futures Lab for the Institute for the Future, among numerous others. So I and Duke Science Society as a whole is very excited to have all three of these panelists here today and look forward to hearing their insights into the transmission and safety concerns for COVID-19 in the workplace, suggestions they might have to mitigate these risks. So to start things off, I'll give each of the panelists about 5 minutes to kind of quickly, introduce themselves and their kind of key work in this area and their thinkings. And we'll start things off, I guess, in the same order. So we'll start with you, Dr. Nicole, and then we'll move to Jessica and then Sharon.
Thank you. Again, I'm Nicole Bouvier, and I'm a faculty member at the Icahn School of Medicine at Mount Sinai. And my major research has, prior to COVID, involved the sort of science of transmission of respiratory viruses and in particular influenza virus. And so I think my role here is to hopefully elucidate some of the science behind what we know about respiratory virus transmission in general, and also how that applies to SARS coronavirus 2. A lot of the work I have done has focused on airborne transmission. So when the virus transmits from an infected host to a susceptible host through the air without any direct contact, and what are sort of environmental and other factors that affect the virus's ability to do that while remaining infectious in between hosts. I think one of the important things to remember about viruses is that they are essentially parasites. They really need a cell in which to multiply. So viruses very rarely are infecting people from the environment, at least not over long periods of time. They really require an infected host to spread them around, and then they need a susceptible host to then infect. And so hopefully I'll be able to answer some questions regarding what we know and don't know about respiratory viruses in general, and this COVID-19 virus in particular. Thank you.
Thank you. And if you want to go ahead, Jessica.
Sure. Thanks so much for this invite, Brian, and to my fellow panelists. So as Brian stated, my name is Jessica Martinez, and I serve as a co-director for the National Council for Occupational Safety and Health. We're also known as National COSH, and we are a federation of local, statewide, and local COSH groups known as committees or coalitions. Of our local COSH groups throughout the country represent several worker leaders, labor unions, health and technical professionals, with the shared mission of advocating, promoting, and educating workers around their rights through workplace health and safety, finding correlations with other worker right issues, whether it's issues of a living wage, immigration, and so forth. We try to find these correlations in the work that we do. Particularly now in this current pandemic, our work has completely expanded and definitely gained some leverage, particularly around the work of some of the most vulnerable worker populations, who we now have titled essential workers. Workers are frightened by being put into life and death dangerous situations without protections, and our role as COSH is to be able to navigate the system, ensuring that we're able to empower worker leadership and organizing for workers to be able to return work safe and sound. We also recognize that this current situation is something that not limits itself to workers. The pandemic and COVID impacts may reach workplaces, but also impacts our communities. When the worker checks out of work, we know that they go back to their communities, potentially impacting the health of their families, other members of the community. So ensuring that workers have the right protocols in place, particularly ensuring that also practices specific laws, but also ensuring that they have a comprehensive infectious disease plan has been one of our big advocacy pieces. We just released our report, as mentioned earlier, called The Safe and Just Return to Work, that provides a couple of recommendations to employers to ensure that we have safe workplaces. Unfortunately, the current state of our government has not provided adequate recommendations. They're far too relaxed in terms of their guidelines. So this report, along with some of the work that we're doing on the ground, ensures that employers, along with the support and input of workers, are doing everything they can to protect worker rights. So I look forward to expanding a bit more on this area and also speaking to what more and more some of the industries that are more impacted, in particular communities of color, how we're taking action.
Thank you. And you're up, Sharon.
Great, thank you. And thank you for having me and to be on this great panel. And I thought I'd sort of frame my work around a real life situation that's unfolding right now, because the work that I've been doing at the Labor and Work Life program at Harvard Law School is around how looking at the pandemic and how it's demonstrated the law needs to change in order to empower workers so that they can be better protected. So in California today, there are actually McDonald's workers who've been on strike for about 6 weeks who are, there's a hearing in a case they've brought to ask the court to shut down their McDonald's because they're not being adequately protected from coronavirus transmission at work. So they're asking the court to shut down this McDonald's because they didn't get proper PPE, they didn't get paid sick days, high touch areas haven't been properly sanitized. And it really highlights how the law is failing these workers, that they've had to take this kind of extreme action of going on strike and suing their employer. First, obviously, it shows the sort of racialization of the impact of the pandemic on people at work, because the pandemic has hit low wage workers so disproportionately, and they are then disproportionately people of color. So that's the first sort of failure that this case highlights. Second, as Jessica just mentioned, it also shows how the federal government is not living up to their obligations to provide a safe workplace. So in addition to sort of joining a call for OSHA, the federal agency, to better protect workers, we also put out a report on how the law could be changed so that workers could have the power they need to demand a safe and healthy workplace for themselves. So we have a series of recommendations, including creating committees where workers can sit at the table with their employers to identify the safety and health problems and strategize about how to fix them. Since workers themselves usually know best what the threats to their health are and the best ways to ameliorate those threats. But too few employers in this time of very low union density, too few employers are actually listening to their employees about that on the ground information. We also recommend that every workplace have a safety monitor who can provide information and confidential advice to workers to a safe workplace. We see too many instances of workers sort of trying to speak up for themselves, but then being retaliated against for doing so. So we think it's important for them to have the ability to get reliable information and to be able to have help in communicating about what they're seeing in their workplaces. And we had some polling done when we put this report out by Data for Progress, and it shows that the public very much supports these kinds of recommendations. But then third, this case at McDonald's also shows how hard it is for workers to form a union, which is really, it's really a safety and health measure. It's a tried and true way of workers being safer in the workplace. So we think a part of any comprehensive safety and health workplace system is to strengthen the ability for workers to form a union. So we've also in our report made recommendations about how to adapt the rules for forming a union to fit sort of COVID workplace, because obviously the nature of the workplace has changed a lot. Workers can't interact the way that they normally do, and so the traditional methods of organizing don't fit. It's much more dangerous for workers to try to talk to each other. They don't have places to congregate in the workplace. About digital organizing strategies and how the law can support, especially for low-wage workers, their access to digital connections to each other so that they can continue to organize, to have union elections, and to engage in collective activity together. But look forward to diving into those more.
Yeah, thank all of you. I think there's a lot of threads we can to really kind of dive into this issue. One place I really want to start though is kind of, to understand safety risk, we kind of have to understand how the virus actually spreads. And so I want to circle back to some comments Dr. Bouvier made. I know you mentioned kind of your past in studying airborne transmission of viruses and things like that. I know for COVID-19, we've typically heard about, exhaled droplets being the mode of transmission. We're recently starting to hear more, more vocal scientists advocating for no, it's airborne. So I guess I was wondering if you could give your thoughts on, what is the difference between these different modes of transmission, droplets versus airborne, if they're both exhaled particles, or they're the same, and what those differences might mean in terms of limiting the spread of a disease.
Yeah, so it's quite complicated, not only because it's something that's hard to study, but also because there's a lot of inconsistencies in the terminology and the definitions that various people use for different modes of transmission. So the way I tend to think about transmission in general is that there are contact modes and airborne modes. So a contact transmission would be something like direct transmission would be, you know, I rub my nose and get virus on it, and then I shake your hand and you touch your nose, contaminated hand. So that requires us to actually directly contact each other. There's also indirect contact transmission where, say I rub my nose and then type on my keyboard, and then virus deposits on the keyboard, and then somebody comes and uses the computer after me. Or I sneeze and cover my mouth with my hand, and then I open a door, you know, and get virus on the doorknob, and then the next person comes along and picks it up off the doorknob. And then there are the airborne routes, which are mainly a droplet spray, which is when somebody coughs or sneezes, the particles that come out of their mouth, including droplets of water, all the other things that are in your respiratory tract, like proteins and bits of dead cells and immune cells, all kinds of things, will come out in wet, and those droplets can actually impact directly onto someone else's mucous membranes in their nose or in their mouth or in their eyes. And so that's sort of a ballistic form of transmission where it's directly out of me onto you, but through the air. And then the final mode, unfortunately has many different names, but it's often called aerosol or droplet transmission. And what that refers to is very, very tiny particles, which there's really no consistent definition for a size that differentiates a droplet from an aerosol, but we're talking about things on the order of 1 micrometer, so a millionth of a meter, which is, you know, about a 20th or 200th of the width of a human hair, depending on how thick your hair is. So it's very, very small. You can't see it. But what these particles are is that they are small enough that they can hang in the air for long periods of time. The force of gravity is not strong enough to overcome the buoyancy of the air that keeps this particle aloft. And where aerosols come from are generally, and I cough or sneeze or even talk, I'm exhaling right now all kinds of respiratory particles. So water-laden bits of protein and other things that are in my respiratory tract. And, you know, if I'm infected with COVID, with the coronavirus as well, will come out in these sort of wet droplets. Now what happens is as soon as the droplet leaves my mouth or nose, it's going to dry out. So the water will evaporate from it very, very quickly. And what's left is whatever the non-water components of the droplet were, the virus, for example, and other mucins and other proteins from my respiratory tract. When the water dries, the particle loses a lot of its weight, able to sort of hang in the air for long periods of time, rather than sort of falling directly onto the floor. So those are sort of the main modes that we're talking about.
And can I, as a follow-up question to that, thinking about this kind of like, you know, ballistic sneezing versus kind of hanging in the air, what kind of implications would that have in terms of, you know, protection someone might need walking around, you know, a factory with other employees who might be sneezing or coughing, or just, you know, you mentioned even just talking can put these in different ways for different modes of transmission. And so what kind of safety precautions might be required to kind of.
So what we know is that if a person is wearing a mask, even just a regular surgical mask, that cuts down dramatically on the particles that are getting out of them and into the environment. So, you know, it's not 100% protective. Somebody will still be breathing out smaller quantities of virus, but it is much more protective of other people around them just to wear something as simple as a surgical mask. for other people around them. Again, a simple surgical mask or even a homemade mask, it will prevent you, first of all, from touching your nose or your mouth, which is something that people do all the time without realizing it. So having just that barrier sort of reminds you, oh, don't, you know, touch my nose. So that cuts down on a lot of contact transmission. And it'll also cut down on a lot of the droplet transmission. So big, heavy droplets that enough that they don't dry out between you and me when you sneeze in my face. What they don't entirely protect against is the aerosols, the very small particles. And that's because if you've worn a surgical mask, you know they're not tight against your face. There are little gaps. And when you breathe, the gaps get a little bit bigger. So small particles can enter you know, around the sides of a mask. The question that isn't pertinent to this disease is how often does the SARS coronavirus transmit by these various modes? And that is a question that, you know, we have some clues on, but we don't have the total answers, which is why a lot of the recommendations that are being made by public health authorities are an effort to cut down on every mode, you know, to mitigate the risk, because we don't know exactly what mode this virus is transmitting by.
Thank you. And then to kind of follow up with that, this is maybe a question we'll start with Jessica, and then I'll have a follow-up question for Sharon. But, you know, considering this kind of uncertainty and like the weight of different modes in transmission, how are, you know, safety groups kind of thinking about the protections that workers need and prioritizing those different protections?
Right. So one important thing to do is, as essential workers are currently at the workplaces, as we're thinking about returning to work, is in sense of a comprehensive infectious disease plan that takes in consideration all these modes, from the social distancing to the personal protective equipment, to allowing certain policies and practices in the workplace that are clearly rooted from recommendations also from the worker. They, more than anyone, really understand the source of the work, how some industries we know naturally are in more confined spaces. So thinking about also the positioning of the workplace is a key element to ensuring some prevention measures around COVID. As it was mentioned earlier, we know that low-wage workers in particular, and in some industries such as meatpacking, work in confined spaces. We are talking about also workers that are not allowed to exercise even basic rights as taking breaks. Now, more than ever, we need workers to sort of allow for that unionization to happen in order for them to exercise those basic health and safety rights, from reporting certain dangers at work and without any fear of retaliation. Again, this is not limited to the worker itself. Whether it's a manager, the communities get impacted. So ensuring, again, that these committees, potentially worker committees, where they can provide these recommendations, is a key piece to that.
Thank you. And then kind of the follow-up, I know Jessica mentioned, you know, some of these workers aren't even getting protections they already have in terms of breaks and things like that. But Sharon, I wonder if you can speak to, you know, OSHA already has a wealth of regulations for safety in various industries, and some which may or may not kind of transfer to offer some kind of COVID-19 protection safety measures. And so I'm specifically in my head kind of thinking about, I know there's like respirator requirements for certain industries, but I wonder how, if you could talk a little bit about how current regulations may offer some protections already that workers can access.
Right. So there are no, as of right now, there are no, see, I'm touching my face. There are no OSHA regulations specific to COVID transmission. In the Obama administration at Department of Labor, we were working on an infectious disease standard that would have set forth how employers had to protect workers in the face of an infectious disease transmission. The Trump administration came in and halted that work. In the past, what OSHA has done is looked at CDC guidance and said, to employers, this is the best thing that we know in short order about how to protect workers. So we're going to enforce CDC guidance. Again, the Trump administration isn't doing that. What they've done is put out suggestions, recommendations, tips on how to keep workers safe. But the key thing that you're missing, in addition to sort of a full process for getting the best possible standard, when you rely on recommendations or suggestions, is that there's nothing that's unenforceable. So workers don't have a way to go to the Department of Labor and say, it's supposed to be your job to keep me safe, to enforce these rules so that I'll be safe, and have OSHA then go out and enforce that. You can't do that with a recommendation. And so workers are really stuck. We're seeing states start to step up and actually come up with their own standards, especially as we're learning more about transmission in the workplace. But really, honestly, and not saying this from a partisan perspective, like, the federal government has just sort of sat out protecting workers during this pandemic.
Yeah, so you mentioned states kind of stepping up. The one I'm most familiar with is Virginia, obviously, has announced these kind of big sweeping emergency regulations. But can you speak a little bit about, how states can step up, how, I know some protections are kind of included in these like public health emergency executive orders regarding like mask wearing and things like that. Can you kind of speak a little bit to how these non-federal players can kind of step up into that space?
There are a number of states where the governors have issued executive orders to put out certain protections. And I think in Pennsylvania, they've actually something along the lines of the safety monitors or stewards that we recommend in our report. There are also 20 plus states that actually set workplace safety standards them states. So that's sort of how the federal system works, is that OSHA makes the rules for the country unless a state has stepped up and said, actually, going forward, we want to set these standards. And so you have states like California and other states that already are in the practice of setting standards for themselves. And so those states have the ability to do that. And then even things like paid leave is actually, in this moment, we don't think of it as a safety and health measure. You think of it as sort of like a workplace benefit, but actually in the midst of this pandemic, paid leave is actually a really important public health measure. And so you see states stepping up.
Yeah, I think that's actually a perfect segue into kind of the next question I had for Jessica. Thinking about paid leave, this is obviously something that low-wage workers generally have less access to. They tend to be in more kind of financially stressed situations where they opt to work sick instead of staying home. And so can you kind of speak to some things like that and other kind of characteristics of these low-wage workers and positions that make them kind of higher risk for COVID-19 infections?
Yeah, sure. The reality is that we know that as the federal government, current laws in place are very limited and provide, don't have the capacity or the intention to want to protect workers with a more comprehensive, considering some of these more vulnerable worker populations. I just want to make one clear point to the earlier question around OSHA, is that we know that although there is not an infectious disease standard under federal OSHA, that there are standards in place that allow workers to refuse hazardous worker conditions. There's a general duty clause. Now, it's important to note, though, that OSHA has been completely missing in action throughout the entire pandemic. We know that there's been a poor documentation of worker fatalities, but nonetheless, we know that there's been many worker fatalities across the country, coronavirus. And we know that there hasn't been any citations in the last couple months of this pandemic. I think there was one most recently done in the state of Georgia at a nursing facility for the lack of reporting. But that just really speaks to the monumental problem of any government protection. Now, in terms of paid sick leave, the same applies. There's a lot to be said. Currently, National COSH, along with several other worker groups, have been really pushing some action around passing the Essential Workers Bill of Rights, will allow One, it will allow workers to continue getting some compensation, unemployment benefits, some expanding paid sick leave as well, because we know it's been completely inconsistent. The Senate, unfortunately, at this moment has failed to take action, and we're really pushing contact their senators in order to be able to pass this comprehensive bill, allowing for those protections. As we speak right now, there's inconsistencies in the system. Not everyone is protected, which has a crippling effect in other areas of impacting workers' livelihood.
And kind of following up on that, you mentioned the general duty clause, and it's, you know, workers maybe being able to kind of get some protections under to work if they don't feel safe, it's a hazardous environment. And so kind of a two-part question to this. We'll start with Nicole first, kind of wondering what some of the like underlying conditions and things workers might have that actually exacerbate and increase their disease burden and make them kind of higher risk. And then kind of the follow on to that for Sharon is how people with different kind of underlying diseases might be afforded these kind of general duty protections under, for instance, I know, was it the American Disabilities Act that has like the reasonable accommodations clause under it. And so if you could kind of speak to how some of those kind of coverages might apply to some of the underlying conditions that exacerbate disease burden. So Nicole, you first.
So we know that there are definitely certain groups that are at higher risk of severe disease or death even from COVID-19. Some of those groups are older people, so the older you get, the worse the outcomes tend to be. We know that people of color, African or Hispanic ethnicity are suffering a disproportionate amount of disease and severe disease and death. People with certain comorbidities like immunocompromised, so people who maybe had an organ transplant or a bone marrow transplant and are on suppressive medications, people have cancer and receiving chemotherapy, people who have a sort of non-intact immune system are at higher risk, people with respiratory disease like asthma or emphysema, things like that. So, you know, there definitely is a, I would say, a sliding scale of risk. And, you know, everybody has a different risk level according to who you are and what other sort of situations you have in your life. And, you know, I think for workers, they obviously know best, you know, who they are and what risk groups they fall into. It's going to be higher risk for some people than others. It just is. And I think, you know, employers definitely have to make accommodations for that. It's not your fault that you're 65.
Thank you. And Sharon, can you kind of follow up with how, you know, imagine that sliding risk, how would some of these like general duty protections under OSHA and things like that apply to different workers?
Sure. So the general duty clause is sort of like a backstop in the occupational safety and health law, intended to sort of cover maybe emerging threats that aren't otherwise covered by specific standards. So it's not, its existence really doesn't substitute for OSHA issuing particular standards, knowing as much as we do about the threats that face workers on the job today. But the other problem is that the use of the general duty clause is all in the hands of OSHA. So workers can complain with the theory that their employers aren't even living up to their obligations under the general duty clause, but it's up to OSHA to then follow through on that. And they're just, as Jessica said, they're just not doing that in this administration. So in terms of like protecting workers generally in the workplace, it's just not, those aren't tools that are working. In terms of workers specific vulnerabilities, you know, as you mentioned, there is like the Americans with Disabilities Act, which should protect workers to be able to get reasonable accommodation. So if possible, they can still come to work, but you have to be able to come to work. staying home is generally, for a long period of time, is generally not considered a reasonable accommodation that your employer has to provide for you. And so we really don't have great tools right now, or at least the government, the federal government, isn't using the tools that we have. What we need is better access to paid sick leave. We need, like we say in our report, better exchange of information between workers and employers so that they can mitigate the risks in the workplace. The other problem with all of our workplace standards is, if you don't, what my boss used to say, like, win the boss lottery. I mean, there are lots of good employers out there who want to do the right thing and are trying to put the right protections in place. And that's great for workers who are employed in those kinds of companies. But for workers who didn't win the boss lottery, using any of these tools takes time. It's a legal right and can require, like these McDonald's workers that I referenced before, to get those rights enforced. And the kinds of crisis that we're facing now is a lot of workers just don't have the time to do that.
Thanks. So I want to kind of move on to looking at some of the kind of specific interventions and safety measures that people are considering. One in particular that I think has kind of a broad category of measures in it is, methods to actually enforce social distancing, whether that be altering the flow of, hallways, or limiting traffic in, elevators or entryways and things like that. And so I guess, again, okay here, what are the kind of things that worker advocacy groups are really kind of looking for and hoping to achieve in terms of these behavioral distancing kind of measures?
And again, I'll have to underscore again the importance of the worker engagement piece, which I think is one that's been lacking consistently in our efforts to make preventative public health recommendations around safety and health, is that every industry, every type of workplace is quite different, whether you're at the office, at a factory, and so forth, the nature of your work. So again, it's hard to sort of provide these recommendations in a very broad spectrum of things, but rather, who are the key players that are able to provide these recommendations for the specific workplaces? And I think, as both of my fellow panelists have mentioned, is that worker engagement piece is so key. As we know right now, we have all these beautiful recommendations in terms of building worker committees, including starting to reopen. We know that governors have, in many situations, built these reopening committees. It's so important that labor is at the table from the very top. That we know that government at the very top is setting the standard of ensuring that worker voices are at the table. So again, if that trickles down to the employer, ensuring that workers are able to provide that those recommendations. Now, the specifics in terms of what that may look like, knowing the general recommendations of social distancing, wearing masks, and so forth, I think those are general protections that we more and more have become mainstream or aware of. Information constantly changing. So we have to take all of that into consideration. But yet again, for the specific workplace, ensuring that workers are sitting to rebuild the workplace and the policies and procedures in place is a key strategy.
And then kind of another specific type of strategy I kind of want to talk about, and this one will probably go to Sharon and Nicole. And so we'll start with Sharon. But there is a lot of talk about, health screenings or symptom checks, or having employees kind of self-report symptoms on an app, things like that. Can you kind of talk about those a little bit within the context of, there's a lot of protections that prevent employers from accessing health information about their workers and things like that. And so how do these health tracking interventions for safety really kind of balance against these, employee protections?
No, it's a really good question. So like you said, there are certain protections in place already in the law to protect when employers do have access to worker health information. But this is obviously on a scale that we really never anticipated, and a use of it in the workplace that we didn't anticipate. And so, I mean, not to sound like a broken record, but you sort of come back to the importance workers being engaged with their employers and figuring out these policies so that there is that level of trust.
Right.
Because without that, you are going to find workers refusing to share that information, being distrustful of how it's used. And this really is, I think, a time where we all need to trust each other in order to navigate all these changes. And I think in this very personal space, that's critically important. And then, of course, again, also the sort of government oversight that information isn't being misused. Because there's a lot of concern about the expansion of surveillance that may be necessary, but we need to understand whether it really is necessary. Then there are also issues just around the fairness of how these systems are implemented. You know, if it takes additional time to have health screenings or to navigate putting on PPE, workers need to be compensated for that time. And so there are a lot of aspects of implementing these programs that we need to find a way to work through together. Yeah. But it's a really important issue.
You mentioned kind of the expansion of surveillance and stuff, and so I want to put a pin on that and come back to that in just a second, but I want to kind of ask the follow-up question to the health screenings to Dr. Bouvier. You know, considering that, you know, there's a lot of asymptomatic there's kind of this confusion around asymptomatic spread and things like that. Are there issues with whether or not, you know, something like temperature screening is going to be effective if, you know, you're screening people who aren't going to have symptoms anyway, but might still spread the disease?
Yeah, I think, you know, most of these sort of public health interventions are, they're risk mitigating, but not risk removing. So you're right, not everyone has symptoms, so they won't have a fever when they show up to work. We don't really know how infectious those people are. You know, one thing that we are starting to appreciate more about infectious diseases is that there are some people who appear to be more effective at spreading disease than others. And so with things like with COVID, we see, you know, certain epidemics that appear to be caused by one person infecting, you know, many other people, rather than the just sort of like this affects this person, you know. It doesn't seem to work that way. And so we know that we suspect that there are probably people who are more infectious than others. We don't know how to identify those people. And we certainly don't know in terms of protecting them and their rights, as well as the rights of people who are working with them. So, you know, there's a lot of unknowns here, but I think what the goal of temperature screening, you know, having to have a negative nasal swab before you go back to work, these are risk mitigating. They're trying people who are sick, knowing that we're probably missing some people. You may have a negative test, and then when you go home on the subway after the doctor's office, you pick up the virus from somebody else. Like, none of these are foolproof. They are meant to reduce as much as possible the risk.
Yeah, thank you. And yeah, kind of picking up that pin out of surveillance, we'll move back to you real quick, Sharon. But thinking about, you know, a lot of these social distancing measures, you know, they do need some employee buy-in to actually adhere to them. But we're also hearing about, you know, various companies and things like hospitals or whatever, instituting, you know, tracking apps or little like RFID radio tracking fobs and their like ID badges or things like that to actually track employee movement to identify, you know, contact risks and things like that. And so can you speak a little bit to that surveillance in terms of employee privacy and that invasive aspect of it?
Yeah, I think there's sort of two categories. So there's what you're talking about in terms of that like physical tracking for coming onto the job. But then there's also in around a lot of people working from home and electronic surveillance that's happening. You know, there is software where employers can track if you were on the employer's system, can track keystrokes, can see any, you know, any internet activity that you have. There's recently the National Labor Relations Board reiterated that you have no expectation of privacy in using your employer email system. So your employers can be reading your emails. Now that have always been true, but for people now, all of a sudden working from home, they're using that email much more. They can't physically, like I was talking about, they can't physically interact with their coworkers. And so there's a lot more traffic in that respect. And you know, again, to this is just a perfect example of a subject that's really ripe for collective bargaining, right? To figure out what are the real needs of employers to understand the risks of their employees in the workplace, of legitimate managerial oversight when you have a workforce that's now dispersed to their homes and not working in one place, and to figure out how to cabin those legitimate interests so that it isn't an opportunity for employers to surveil in a way that's not actually needed in order to address the pandemic.
If I could just add to that as well, is you know, it's interesting as we discuss surveillance for workers, and sort of there's a hyper focus that continues and has been a longstanding issue in health and safety of individual worker behavior and what that means and how that impacts the workplace, and allowing employers to blame and shift the blame to the worker. Again, our push, and I'm speaking on behalf of our network, has also been the importance of ensuring that employers are doing everything that they can to protect workers, or some level of enforcement and survey on employers to ensure that they are taking the right, you know, doing the right measures. So I want to also emphasize this, because I think there is always a shift in the discussion of individual worker behavior and blaming the worker, but it is a system in place that we really need to analyze and assess of what's happening in the workplace, that will allow for a more comprehensive work plan to be established and have a greater impact overall. But also regarding just back to a little bit on the testing piece and contact tracing is, and we have to also do a better job of picking up on best practices. We know that there's other countries have done a much better job than us, and they're reaping the rewards now, while we are faced with this tsunami of incidents with workers of color at the bottom of the ladder in terms of protections and highest people infected. So really that piece is one that we have to not underestimate in terms of being able to track, you know, the impact of COVID.
So we got about 10 minutes left. And so I want to give you each a chance for final kind of few minutes each for your key points, closing thoughts. But one last question I had is kind of, let's look at like a hypothetical situation. Like, I am a asthmatic worker, a low income job. It happens to be like let's say like a meat processing facility or a factory where I'm kind of in a crowded environment. And so let's say, you know, I can't wear a mask because I have asthmatic problems with breathing, but now this exposes me to greater risk for the disease. How should we think about protections for that? And I guess we'll start with Nicole, and then I'll let Jessica and Sharon kind of follow up on that.
Yeah, I mean, that's a tricky situation. Legitimately for medical reasons, cannot mask. You know, in general, we can usually find some sort of face covering that is less intrusive or suffocating feeling for people who, you know, have breathing problems. But, you know, there are people who do have difficulties. You know, you don't need to wear an N95. Those are hard to breathe through. You know, they're more protective, but certainly, you know, you do what you can do. You can wash your hands or use alcohol-based hand sanitizer. You know, certainly from the personal perspective, there are things you can do to protect yourself, like try to stay away from other. In terms of what the employer can do, that's sort of not my area of expertise. But you know, again, we're talking about, you know, risk reduction rather than risk elimination. And so I think, you know, it's hard to find the balance between what you can do for an individual individual person, protect them, like what's possible, and what they need to be protected. So I think it has to be an individualized situation according to, what the person has to cope with.
Thank you. And Jessica, Sharon, do you want to?
Sure. I mean, I think it goes straight to the workers being able to stand up and exercise their rights and essentially organize. So workers, we know that in the current situation, have stood up in many ways from the beginning of the pandemic to push back on grossly dangerous situations they were put and inadequate protections. Workers, as mentioned earlier, do have the right to refuse hazardous work and to take concerted action together to demand adequate protections. However, we know that unfortunately, the reality is that we know that the federal government is not protecting our workers. However, there are efforts and organizations out there, such as our local COSH groups, that are taking collective action, organizing workers. We know unions are also being more intentional for those that are out. And I think being involved in those levels of network, allowing the worker to really inform themselves of what their options are, is a key piece to exercise their rights.
Thank you.
So I obviously agree with everything, Jessica. I think, July, sadly, is a really appropriate time to have this conversation because the sort of expanded access to unemployment benefits that Congress passed at the beginning of this nightmare are set to expire at the end of July. And there's just no way around it. There has to be a level of government support for people who can't work safely. So in your hypothetical, if that person truly cannot work safely, then they need to have support so that they can continue to support their family, to have a roof over their head. It shouldn't be hard, although it does seem hard in our current political environment, to have a principle that nobody should have to put their lives at risk in order to bring a check. Like that seems to be the basic level of protection that we should provide workers. And so July, Congress will have figured this out a little bit and make it clearer that workers who really can't work because of their particular health situation do have continued access to that kind of unemployment insurance benefits at home.
Yeah, thank you. So yeah, we're down to the last few minutes. I've got a million more questions, but we'll have to save those for another time. I'll just give you each 2 or 3 minutes if you want to have any closing thoughts, key takeaways you want people to have from this. And we'll start in the same order we did at the beginning. So we'll start with the science and build up from there. So take it away, Dr. Bouvier.
So I think, the science, in terms of the science, we're in a bit of an evidence limited zone here. There's a lot of things we don't know about how this virus is transmitting, and there's a lot of things we don't know about how to best protect people from acquiring the virus. So in those such situations, we end up with a lot of sort of expert opinion, and expert opinion doesn't always agree. So it can be very confusing to figure out, like, what should I actually be doing when you're listening to 2 different sides of the same story. I think, in general, consent is a good thing to have. So, do the things that you think you should do. Wash your hands, use a hand sanitizer, wear a mask if you can, try to stay from other people. The farther you are away from somebody else, the more volume of air there is for any viruses that person is breathing out to sort of diffuse into, and the less your chances that you're going to breathe in one of those viruses. So, if somebody is coughing up a storm on the subway next to you, maybe you move away. Just try to do the things that your grandmother would think was smart when things are not unclear the way they are currently.
Thank you. And closing thoughts, Jessica?
Yeah, again, appreciate this opportunity. I think that our network is one that represents workers being able to take action and encourage our communities to demand that we are able to exercise our rights without the fear of retaliation. So with that said, I do this an opportunity to promote a little bit our day of action, which we have on Tuesday, July 14th. And we'll have an opportunity to pray for the dead and fight like hell for the living is what we're titling this event. And it's an opportunity to pay tribute to a lot of fallen workers. And we're also demanding that the Senate pass the HEROES Act, which has the key pieces to the Essential Workers Bill of Rights that will allow for better health and safety protections, robust premium compensation, protection for collective bargaining, paid sick leave, and protection to worker whistleblowers, as well as some healthcare security, which are all key elements that will allow workers to return back to work safe and in a just workspace. So I just want to invite everyone to inform themselves, learn a little bit about those efforts, and invite you to visit our website on ways that you can take action.
Thank you. And take it away, Sharon.
Okay, so I'll finish this off by sort of pulling back a little bit. Like, I think it's really important, and really appreciate the opportunity to have this conversation focused on what's happening in American workplaces right now. But I would encourage people to like step back and think about the fact that the precarity and the vulnerability of the workers who are dying in this country from COVID in the highest numbers, this is not a new situation. I mean, maybe the statistic, but it reflects that same vulnerability and precarity that's been present in our economy very long time, and we're just seeing it in starker relief right now. And so I think that's an important perspective to have, and also to put it in the context of this is not just a COVID response. This is has to be a racial justice response too, because again, it is another way of seeing the incredible inequity that has been built into our economy for a long time, that's just sort of bursting onto the scene in a different way. But it is a moment to address both the immediate public health problem, but also to begin to address these more bedrock issues in our economy. And so I hope we can continue to keep a conversation between those conversations.
Yeah, thank you. And hopefully we've got some good experts listening here that can now spend the rest of the afternoon taking everything you guys have said and implementing it into some solid action. So, but I want to take the time to thank all three of you again. This has been great. I think it's been very insightful. So yes, thank you for spending the time to talk with us. Thanks all our audience members for taking time out of your day to listen to us. And yeah, I hope everyone has a great day. Thank you all.
Thanks.
Thank you.